Thank you everyone again so much for joining today's virtual office hours. My name is Dana and I'm a research analyst here at the dashboard. Today's session, we're just going to do a brief history and a walkthrough of this site and also go through our latest updates that we made in August. And I'm joined today by Hannah Wade, who's our Senior Population Health Policy Analyst. And since we have a smaller session today, a smaller group today rather, if you have any questions at any point, you can put them in the chat. But also at the end of today's session, we'll do a Q&A, so you can come off mute and ask your questions then as well. And so let's get started. Okay, so until now, rigorous and nonpartisan data and conditions that affect health have not been widely available at the congressional district level. We really created this dashboard to kind of address this, and we launched it in 2023 to address the challenge. As its first of its kind tool, our mission is to provide rigorous, accessible, and nonpartisan data on the health and conditions that affect health on the congressional district level. And so that's really our goal here at the dashboard, is to have this data that can be used to drive positive change at the district, state, or national level. Data by itself can't change policy, but it can be an important facet in doing so. Data can illuminate those challenges and assets in communities that might have otherwise been hidden. It can inform effective policy solutions, and it can hold leaders accountable as well. And so the data on our site can provide that information that can support data-driven decision-making. We built this tool for a wide audience. Think elected officials and their staff, advocates, journalists, researchers, the media, the general public, or really anybody who has an interest on congressional district level information and on health. So our team at NYU Grossman School of Medicine's Department of Population Health built this dashboard off the success of our sister site, which is the City Health Dashboard that we launched in 2018. Our partners include the Robert Wood Johnson Foundation, the Bipartisan Policy Center, as well as the Center on Budget and Policy Priorities. So the big question is, what do we measure? We have a total of 37 metrics under 5 overarching domains, as you can see here. So the first one is health outcomes. So think like breast cancer deaths and cardiovascular disease deaths. Social and economic factors like chronic absenteeism and unemployment. Health behaviors, physical environment, and clinical care are other domains, and you can see the metrics underneath that. For metrics that you see have like a orange asterisk here, we have demographic breakdowns available. So think, race and ethnicity and sex. And any metrics that have the green triangle, we have the census tract level or neighborhood level data for that. Our dashboard data is drawn from federal resources and other data sets that adhere to rigorous standards of data collection and analysis. So this includes the U.S. Census Bureau, the Centers for Disease Control and Prevention, and the Environmental Protection Agency. All of our measures really aim to be actionable and reflect public health priorities. Our team of population health and policy experts, epidemiologists, and geospatial specialists regularly update the site with new years of data as they become available, new measures across the 5 overarching domains as well. And so in our latest updates, we actually have a total of 3. We've added 2 new features, and we've also updated one of our metrics, the Medicaid Enrollment metric. This metric we launched in February of 2024. We initially started with the first quarter of data as the last quarter of 2022, and we had it through the third quarter of 2023. So in the August release, we added 2 quarters of data. So we had the latest quarter of 2023 and the first quarter of 2024, giving us a full year and a half of data for this Medicaid enrollment metric that we have. Our next and first feature update is the cities and congressional districts feature. This in particular is the first time ever that we've cross-linked our Congressional District Health Dashboard with our sister site, which is the City Health Dashboard that was launched in 2018. So users can find the cities that we have on our City Health Dashboard that's located in their congressional district. So this can be helpful for those who might be interested in looking at cities within their congressional districts and how that metric estimate is compared to their larger congressional district. And this is a little screenshot and an example of what it looks like on our site, and that's under our district facts, which I can show you later in our site walkthrough. Our second and last new update to our site is our state level snapshots. So we previously had state level data on our site. You can see that through our metric maps, where you can select on a state and see how a metric kind of looks like on congressional district level in that state, and also in our compare districts feature. So that compare districts feature, you can select different comparators like different states, and different districts will be the comparators that you are interested in. We've added the way for you to look up your state from the homepage of our site, and also seeing snapshot all of the metrics of that state at a glance. And that was really all for the brief history and some information about our latest update. I'm just going to pause here and see if anybody had any questions in the chat. I changed to our site walkthrough. So this is our homepage. So when you go to the Congressional District Health Dashboard.org, you're brought to this section where you can look up a congressional district or state by the address. Or if you knew which one you were looking for specifically, you can use this tool down here. So let's look at Missouri State. If you click on that, it brings you to the first part of our site, which is the health snapshots. If you were on our site previously, before release, this was called the district snapshots, since we only had district level data for this part. We've added that state level data, so we've kind of refreshed it, and it's now called the health snapshots tool. Here you can see all of the metrics on our site, how that looks in Missouri at a glance. You can see the metrics, the domain that they fall under, the state estimate, and the comparator to the US. We use a green circle to indicate times when the estimate is doing better than the US average, a green triangle for when it's doing just about the average, and we use a red square for when it's doing worse than the average. You can see the comparison legend over here. And you can also filter by domain, which is really helpful if you have a specific interest as well. And in this part of the site, this are state facts. So you can see the breakdown of population by age and race and ethnicity in the state of Missouri. And at the bottom here, you can see state representation. We really aim to be very helpful for our users who might be interested in multiple localities. So we have this tool here where you can change the location of interest. So let's say we're going to look at Missouri's 1st district. I'll click on that and it just changes over. So this will not change from what you saw previously with the state level snapshots, other than the updates to the estimates and the comparators. So let's say you're interested in social and economic factors, particularly, you can filter out that, and you can see the whole list of all the metrics that fall under that domain. I'll select high school completion. So in Missouri's 1st, 91% of adults that are older or equal to 25 years old have a high school diploma or equivalent, or a higher degree. And this is actually just around the US average. All of our metrics, you can click on here, bringing you to the next part of our site, which is the metric maps. At the top, you can see our scale bar, seeing how Missouri's 1st compares to the US average. We also include a sense-making statement to help you kind of understand that data a little bit better. Across all of our site, and also on the City Health Dashboard, when you see a darker color, that indicates when it's poor outcomes, and lighter colors when we have better outcomes. So in this case, you can see Missouri is doing pretty good, and it's the light purple over here. On this left side bar, you can change the state or congressional district of interest. You can change the metric. You can also change the time period for when we have more than one available for that metric, and change the comparison value to the state value when you're looking at the district level. So we can change to Missouri, and that'll update at the top for you. So this metric in particular, we do have neighborhood level data available, or census tracts. You can toggle that, and you can see how that distributes within Missouri's 1st. And also see that breakdown of high school completion in Missouri's 1st. You can click on that, and it'll bring you to this part. You can see the breakdown by sex and in race and ethnicity. So that's all for our demographics page. Going back to our health snapshots, one of our newest features of the site is being the cities in the districts. You can actually see that boundary click up, and if you wanted to see more of the high school completion in the city, you click on that and look at the metric detail for high school completion. So it might be helpful for those who wanted to see that comparator. Going back to our Congressional District Dashboard site, this is our feature that we launched in June of 2024, the Compare Districts. Wanting to compare Missouri's 1st district and to the state and other ones as well. Oops. Yeah, so you can use this tool and select any state or congressional district that you are interested in. We show two ways to compare that with a scale bar at the top and these cards at the bottom. You can see the actual region highlight and populate here. Wanted to know a little bit more about high school completion, you can go to our metric backgrounds page and go to high school completion. And on this page, we provide more information as to the definition of the metric, the source. We include why we measure it, how we measure it, the calculation, and the years of collection that we have for this as well. And our last part of the site, in this hamburger menu, you can see that we have access to the data. So this is really helpful for those who might want to download and do other analysis on their own. All of it is downloadable, including a technical document and a code book after you fill out this survey. But that is all that we had for the site's main features. I'm going to highlight our last and our newest update that we had in August, which is the addition of 2 quarters for Medicaid enrollment. So under metric maps, selecting just the Medicaid enrollment metric, you can see how that distributes across the nation. It defaults to the most recent time period, so that's the first quarter of 2024. And you can change that if you wanted to see the other one. So the second other quarter that we added was quarter 4 of 2023. Yeah, that is really all that I had for today's session. We walked through the site, we gave you the brief history, and went through our latest updates.